There you go. Okay. Hi, Lance. Dr. Buford. We're just getting started on the, yeah, when you're done, we'll have Lo on this side. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything we see is magnified 30 or 40 times on the screen. I'm just getting a few more things organized. You're going to see a shaver come in, that gray cannula. Okay. Can you hold this just for a second? We're just going to lock down that gray cannula. And now this is the biceps tendon. This is the reason we're here. We wanted to investigate this. As we look up as it exits the shoulder, it looks pretty good here. We'll look down at the insertion, and this is where I was concerned. And you know what? This may be good news. This may just be what we call a type 1 slap lesion and not a type 2. A little bit frayed there. But I'll tell you what, it's not peeling away from the bone as much as I usually see before we do a tenodesis. So like I said, this may be good news, maybe a little bit less surgery that you need. That's really not that bad, so I'm actually encouraged by that. We'll look up at the rotator cuff on this articular side. We'll rotate the camera. And the rotator cuff here, as we flush a bunch of water through, looks pretty good. This is the undersurface of the cuff. That's normal vascularity. We can see the insertion into the humeral head. As you come around and look, hold the shaver for me. As you come around and look at the posterior shoulder, we can see that you've got a little bit of a labral tear here. Which we can usually just use our shaver to take care of pretty quickly. You did not have any instability on exam. And here's this labral tear right here. See that? So I think that may be part of the problem as well. And like I said, we can debride this pretty quickly. I'm going to switch positions with the scope in just a minute. The posterior capsule here looks pretty good. But this labral tear is, I think, what triggered the MRI scan reading as well. Okay, pausing. Okay, so now we're looking down the front of the shoulder, and this anterior anatomy looks great. Labrum doesn't look torn. Anterior capsule looks good. So, well, let me give you that. So I'm going to go ahead and put the scope in the front in just a second here. And we'll put the shaver in the back. So we'll take a couple switching sticks. We'll show you that in just a minute. Okay, so now we're looking from the front to the back. This is this area of the labrum that was frayed. And you can see now that we've got it debrided, it looks like it shouldn't bother you anymore. We'd already worked a fair amount with the shaver in the front, but now I just like taking this second look from front to back just to make sure we've done everything that we want. So now that looks pretty good there. Posterior rotator cuff at the top of the screen looks great. So we're done inside the joint. I'm going to go off on the video. We're going to look in the subacromial space next. Okay, so here we're up above the rotator cuff. The rotator cuff's down here below. This big barbaric looking instrument is really only about the size of a pencil, and it is a high-speed burr. As I hit the button, you can see how it spins really fast and has suction attached to it. So this is what we use to thin out the bone, and this bone here is called the acromion. You can see we're going to take off about, this thing's about 5 or 6 millimeters, so maybe 5 millimeters of the anterior lip of the acromion, because I think this is really the main thing that was causing your impingement symptoms. And as we sweep across underneath, you're going to see a big difference in how much space there is. See, look right here, there's not much space between the bone and the rotator cuff. When we're done, we're going to have almost a centimeter more space from the way it looks here. We'll rotate the camera up a little bit. And so what I'm doing is making sure this bone is nice and flat. Now we can see the anterior edge. And that looks great. So I'm very happy with that decompression. But now look here. Here's the key. Look how much room we have now. So I'm happy with that. Your clavicle is over here, which is your collarbone, of course. And as I feel under here, I don't feel any spurs. So other than a little bit of what we call coplaning, I don't think we have to do a formal distal clavicle excision. Hold the camera there just for a sec. I'm going to put the shaver back in just to get one final good look at the cuff. So in summary, I think this is going to end up being good news. We're going to minimize your rehab time because we're not going to have to detach and then reattach the long head of the biceps tendon. Let me focus a little bit. There we go. All right, that's not it. There we go. Okay. So your clavicle is right back here. You can see the cut edge. I'm happy with that. I'm just turning on the suction to make sure any little bone chips that are easily evacuated come out to the shaver. And then I just wanted to show you this as we look down at the cuff. Hold that just like that for me. As we look down at the cuff and rotate, we can see the superior surface here. And that rotator cuff looks great. I don't see any signs that you have what we call a bursal-sided tear, which sometimes can cause very similar symptoms, but you don't have that either. So we've had a good look inside the shoulder today. Surgery time's been about 21 minutes. And we will finish up here and get you back to the recovery room. Good luck to you now. Bye-bye.